A tracheostomy is a surgical opening into the trachea with insertion of a cannula to provide a reliable airway. The cannula that is inserted into the trachea is called a trach tube. The trach tube can be double or single lumen. The double lumen trach tube has an inner and an outer cannula. Care of the double lumen trach tube involves removal and cleaning and replacing of the inner cannula as ordered by the physician. The trach tube is secured in place with trach ties or with Velcro ties. People with tracheostomy tubes do not have the upper airway to humidify the air that is breathed. So a humidification device such as a T-vent, a humidifier, or a passive condenser is needed to prevent tracheal secretions from becoming too thick or potentially occluding the airway. If accidental decannulation occurs, the cannula or trachea accidentally comes out. Be prepared to call 911. The opening that's created in the neck is called a stoma. The care of the stoma is done using a clean procedure. Tracheostomy stoma care is done to clean the secretions around the stoma site, maintain skin integrity, and to help prevent infection. At the stoma site, accumulated secretions can become a breeding ground for infection. Within the tube itself, accumulation of secretions may affect the patency of the airway, may clog the trach tube, and could result in trach obstruction. Monitoring the trach placement, the security of the trach ties, and then the integrity of the tube is important to prevent complications such as a blocked trach or accidental decannulation. Decannulation is when the trach tube comes out completely or partially. Please remember, if this happens, in order to maintain the airway, call 911. Trach care should be provided as ordered by the medical doctor. You should observe the stoma, the area around the trach, daily and more often as necessary. You examine the neck for signs of redness, swelling, any skin breakdown, or rashes. Observe the stoma for drainage and odor or skin breakdown. Observe the inner cannula. Observe the dressing for wetness if a dressing is used around the stoma. The stoma area should be pink. There should not be any blood at the site, and it should be free from infection, free from drainage, and free from dried secretions. The skin should be intact around the stoma without swelling. The ties or the trach holder should not be too tight or too loose. A general rule is if you can slip one finger under the tie at the back of the neck, then it is not too tight or too loose. If you do see signs of redness or infection or drainage, please be aware that you need to let the parent or guardian know. In order to do trach care, you would first assemble the supplies that you need before the trach care is begun. Wash your hands, put on gloves before you begin to do the trach care. Place a small rolled towel under the patient's shoulders if the patient is in a flat or supine position. The consumer could also be in a semi-reclining position, just with their neck hyperextended, just as I did mine. If a trach gauze or sponge is used, then remove that and discard the soiled dressing that you've just removed. Examine the stoma site and neck for any redness, swelling, drainage, blood, or foul odor. Clean the stoma and the surrounding skin with the ordered solution. That might be, for example, hydrogen peroxide and sterile water mixed half and half, or it could be with warm soapy water. Use the solution that is ordered for your particular person. Clean the upper stoma, that is above the trach, in a clockwise motion in an outward direction, moving from against the trach outwardly. Then do the same thing for the lower half. The swabs that you use to clean around the area should not be dripping with the solution. You do not want to let any water get into the stoma because of the risk of aspiration. Clean around the tube and under the flanges with your moistened swab or Q-tip. Then repeat that cleaning with just saline after you've done the peroxide and the saline or the soapy water. If the trach has an inner cannula, stabilize the cannula with one hand and remove the inner cannula with your free hand. Drop the cannula into a peroxide or normal saline solution. Gently cleanse it, but thoroughly cleanse it using a Q-tip or brush or a pipe cleaner. Now rinse that inner cannula with just saline, shake the excessive water off, then reinsert the inner cannula and lock it into place. If the patient uses a dressing around the stoma, then place a clean split dressing around there if ordered by the physician. Use any creams or ointments only if ordered by the physician. Your care of the stoma area may just involve cleaning around it instead of removing the cannula. That might be performed by a parent or guardian. Then remove your gloves and wash your hands thoroughly for your own protection. If you do observe any signs of redness, swelling, drainage, or blood, be sure to report these findings to the parent or guardian. For a person that has a tracheostomy, observe for any difficulty that they might have in breathing, any problems with their respiration. This observation should go on throughout the time you're with your client. Any difficulty breathing could be a sign of obstruction, or it could be a sign that the cannula is partially out. The supply list that you might need or that you will need when you're doing your trach care includes a brush, a pipe cleaner to clean the inner cannula if it is a double lumen trach. You'll need a suction machine and suction catheters. If required or needed, suction the trach before you begin the care. You'll need cotton-tipped applicators or Q-tips. If you're going to be cleaning the inner cannula, you will need 2 containers, one for solution that has saline and peroxide, 1/2 and 1/2, and then another one for just the saline. You'll need the hydrogen peroxide and saline. You'll need gloves and gauze if you use a dressing around the area, and then a towel roll if you're going to place that under the person's shoulders in order to hyperventilate the neck. Tracheostomy care should be given following the orders of the doctor, followed carefully. A few other precautions or things to be aware of, special considerations for a person with a trach. Use caution to prevent water from entering the stoma. That could be aspirated into the lungs. Use caution to prevent foreign objects from entering the stoma. Use a cap over the vent or a T-vent if that is ordered by the physician. Also, for a person with a tracheostomy, avoid environmental hazards or contaminants or irritants such as smoke, perfume, hairsprays, or chemicals. Also be careful not to use powders around tracheostomy, as those can be, the powder can be breathed into the lungs. Remember the special precautions that are needed for a person with a tracheostomy. If you have any questions, be certain that you ask the parent or the guardian, or if you have any concerns, always observing for any signs or symptoms that there might be problems or a difficulty.